Step 1. Preparation and cleansing the wound bed. Before starting any wound treatment, make sure to thoroughly clean your hands and wear a new pair of gloves. Cleanse the wound in accordance with local policies and guidelines. Step 2. Choosing the right product. Flaminal is a primary wound dressing and comes in 2 formulations: Flaminal Hydro for slightly to moderately exuding wounds and Flaminal Forte for moderately to highly exuding wounds. As the wound exudate levels change throughout healing, you can step up to Flaminal Forte if exudate levels increase, and step down to Flaminal Hydro if exudate levels decrease. Step 3. Applying Flaminal onto a secondary dressing. After cleansing the wound bed, open up your tube of Flaminal and break the seal. Apply Flaminal evenly onto the dressing, ensuring a minimum thickness of 4 to 5 millimeters. Finally, apply the dressing to the wound. Flaminal is a primary wound dressing, so please ensure that Flaminal comes into contact with the wound bed. The dressing doesn't need to be an exact fit, as Flaminal will not cause damage to the surrounding skin. Applying Flaminal with a spatula. After cleansing the wound bed, open a tube of Flaminal and break the seal. Then, open your spatula and apply Flaminal onto the spatula. Then apply to the wound, ensuring a minimum thickness of 4 to 5 millimeters. Applying Flaminal with a nozzle. After cleansing the wound bed, open up your tube of Flaminal and break the seal. Open up the nozzle, screw the nozzle securely onto the Flaminal tube and remove the lid. Apply Flaminal evenly onto the wound, ensuring a minimum thickness of 4 to 5 millimeters. Applying Flaminal with a syringe. After cleansing the wound bed, open up your tube of Flaminal and break the seal. Open the syringe and remove the plunger. Decant the Flaminal into the syringe barrel and reassemble. Finally, apply Flaminal evenly onto the wound, ensuring a minimum thickness of 4 to 5 millimeters. Applying Flaminal directly from the tube. After cleansing the wound bed, open the tube of Flaminal, break the seal, and apply Flaminal evenly across the entire wound surface, ensuring a minimum thickness of 4 to 5 millimeters. Please ensure the tube doesn't touch the wound. Step 4. Selecting a secondary dressing. For a slightly exuding wound, we recommend you use a non-adherent secondary dressing. For a moderately exuding wound, we recommend you use an absorbent, non-adherent secondary dressing. For a highly exuding wound, we recommend you use a superabsorbent, non-adherent secondary dressing. Dressing change frequency. Healthcare professionals should use their clinical judgment to determine frequency change. However, a general guide would be for slightly exuding wounds, change the dressing every 3 to 4 days. For moderately exuding wounds, change every 2 to 3 days. For highly exuding wounds, change every 1 to 2 days. Change frequency tips. Flaminal can remain in place as long as the gel structure is intact. 1 to 4 days, depending on the level of exudate. Ensure to check the dressing daily. If the secondary dressing is soaked within 24 hours, step up to Flaminal Forte. Cavity wounds. Cleanse the cavity in accordance with local policies and guidelines, ensuring any cleansing solution is dispensed into the cavity space where possible. Before applying Flaminal, begin by probing the cavity to assess its depth after cleansing. After cleansing the wound bed, open a tube of Flaminal and break the seal. To fill a cavity, you can use either a syringe or a nozzle. Tips. Flaminal promotes continuous autolytic debridement, which may initially increase exudate levels. As a result, the wound or dressing might appear soiled due to the presence of slough and debris within the gel matrix. While this may seem unpleasant, it is a natural part of the healing process, as devitalized tissue is broken down and removed. If needed, consider stepping up to Flaminal Forte or using a more absorbent secondary dressing to manage the increased exudate. Always ensure the wound is cleansed and assessed before adjusting the treatment plan. If you notice alginate flakes appearing on the edges of the wound, this is nothing to worry about. It will protect the skin edges from maceration. If you see them on the wound bed while using Flaminal Forte, it's a sign that it's time to step down to Flaminal Hydro. Only one primary dressing is needed when using Flaminal. The first time a patient is treated for wounds which might reach the level of bones and joints, or with exposed bones and joints, the patient should be under observation for at least 30 minutes after the administration of Flaminal. For wounds in areas where a secondary dressing is difficult to apply, Flaminal may need applying more frequently. For example, for wounds in intimate areas, after washing and toileting. Once opened, and if recapped carefully, a tube of Flaminal, Hydro or Forte can be stored at room temperature and used for 12 months. Tubs can be used for 1 week. Flaminal. Easy to use. Flaminal is an easy-to-use primary dressing for acute and chronic wounds, infected wounds, and wounds at risk of infection. It can be applied in many ways and can be used for a variety of wound shape or size, making it easy to use. Flaminal, a unique dimension of wound care.